What if I told you that September 11th isn't just another day on your calendar? It's the day that could make or break your retirement budget for the entire next year. Millions of Americans are about to find out exactly how much their Social Security checks will grow in 2024, and trust me, you'll want to stay tuned for this one. Whether you're receiving Social Security retirement benefits, disability, SSI, VA benefits, or railroad retirement, this announcement affects your financial future. And I'm going to break down everything you need to know, plus share some game-changing Medicare tips that could save you thousands. Before we dive deep into these critical updates, make sure you hit that subscribe button and ring the notification bell. Let's talk about why September 11th has become such a pivotal date for millions of Americans. The Social Security Administration is set to release the Consumer Price Index data that determines the cost of living adjustment, or COLA, for 2024. This isn't just another boring government announcement, this is the moment that determines how much more money will be hitting your bank account next year. You might be wondering, why should I care about this particular announcement? Well, imagine trying to stretch your current benefits to cover the rising costs of everything from groceries to gas. That's exactly why the COLA exists, to help your benefits keep pace with inflation. Without it, seniors and disabled Americans would watch their purchasing power shrink year after year. Now, I know what some of you are thinking: didn't we just get a massive COLA increase last year? You're absolutely right. 2023 brought us an 8.7% increase, one of the largest in 4 decades. But here's the thing: inflation has been cooling down, and that means this year's adjustment might look quite different. Some experts are predicting a more modest increase, possibly around 3–4%, but we won't know for sure until that September 11th announcement. Let's break down exactly who this affects. First, we've got our Social Security retirement beneficiaries. That's about 48 million Americans who've worked hard their whole lives and earned these benefits. Then there are our SSDI recipients, roughly 9 million disabled workers who depend on these monthly checks. SSI beneficiaries, including elderly and disabled individuals with limited income and resources, they're watching this announcement too. And don't forget our veterans receiving VA benefits and our railroad retirees. This COLA announcement impacts all of you. But here's something many people don't realize: the COLA announcement isn't just about how much more money you'll receive. It's about understanding how to make the most of those increased benefits. For example, did you know that a higher benefit amount could affect your eligibility for other programs? Or that it might change your tax situation? These are the kinds of details you need to be aware of to make informed decisions about your financial future. Let me share a story that really drives this home. Last year, I worked with a retired couple, let's call them Bob and Mary. They were excited about the 8.7% COLA increase, but they didn't realize that it would push their income just high enough to affect their Medicare premiums. They ended up paying more for their healthcare coverage because they hadn't planned for this change. Don't worry, though, I'm going to show you how to avoid situations like this. Speaking of Medicare, let's talk about something that could save you thousands of dollars: Medicare plan selection and enrollment. You see, the COLA announcement comes just before the Medicare annual enrollment period, and that's not a coincidence. This is your opportunity to review your coverage and make changes that could significantly impact your out-of-pocket costs. Here's a question I get all the time: should I stick with my current Medicare plan or look for something new? The answer isn't one size fits all, but I can tell you this: too many people automatically renew their existing plans without shopping around, and that's a mistake that could cost you big time. Insurance companies change their plans, premiums, and coverage options every year. What was the best deal last year might not be the best deal this year. Let's talk about Medicare Advantage plans for a moment. These plans have become increasingly popular, offering additional benefits like dental, vision, and even gym memberships. But here's what you need to watch out for: while the premium might be lower, or even zero, you need to look at the total cost of care. What are the co-pays? What's the maximum out-of-pocket limit? Which doctors and hospitals are in network? These details matter more than you might think. And don't forget about Medicare Part D prescription drug coverage. This is where many people leave money on the table. Different plans cover different medications at different costs, and the differences can be substantial. I recently helped a client save over $2,000 per year just by switching to a different Part D plan that covered her medications more favorably. That's real money that could be staying in your pocket. Now, let me address something that might be worrying some of you: what if I make the wrong choice? That's where understanding your enrollment periods becomes crucial. The annual enrollment period runs from October 15th to December 7th, giving you time to compare plans and make informed decisions. But there are also special enrollment periods for certain life events, and the Medicare Advantage open enrollment period from January 1st to March 31st provides another opportunity to make changes if needed. Here's a pro tip that not enough people know about: you can get free, unbiased help with Medicare decisions through your State Health Insurance Assistance Program, SHIP. These counselors can help you compare plans and understand your options without trying to sell you anything. It's a valuable resource that too few people take advantage of. Let's circle back to the COLA announcement for a moment. One thing that often gets overlooked is how this increase affects different beneficiaries differently. For example, if you're still working while receiving Social Security benefits, you need to be aware of how the increased benefit amount might interact with the earnings limit. For 2023, that limit is $21,240 if you're under full retirement age, and every $2 you earn above that results in a $1 reduction in benefits. And here's something else to consider: the COLA increase affects not just your monthly benefit, but also other important thresholds. The maximum earnings subject to Social Security tax will likely increase. The earnings needed to qualify for a quarter of coverage will go up. Even the threshold for what counts as substantial gainful activity for SSDI recipients will be adjusted. These changes might seem small, but they can have significant implications for your financial planning. Let me share another real-world example. I worked with a disabled veteran who receives both VA benefits and SSDI. He was concerned about how the COLA would affect his benefits from both programs. The good news is that receiving both types of benefits is perfectly fine; they don't offset each other. But understanding how each program adjusts for inflation and what that means for your total income is crucial for effective financial planning. Now, I know some of you might be wondering about SSI recipients specifically. The COLA adjustment affects you too, but there's something important you need to understand. While your benefits will increase with the COLA, you still need to stay under the resource limits to maintain eligibility. For 2023, that's $2,000 for individuals and $3,000 for couples. These limits don't increase with the COLA, so you need to plan accordingly. Let's talk about Medicare premiums for a moment, because this is where things get really interesting. The Part B premium is usually deducted directly from your Social Security benefit. In most years, the Part B premium increases, which can eat into your COLA increase. But here's the good news: thanks to the Social Security hold harmless provision, your net Social Security benefit can't decrease due to an increase in Part B premiums. However, there's a catch: this protection only applies if you're already having your Part B premium deducted from your Social Security benefit. If you're paying your Medicare premiums another way, or if you're new to Medicare, this protection doesn't apply. This is just one more reason why understanding how these programs work together is so important. Here's something else to think about: how will you use your COLA increase? While it might be tempting to view it as extra spending money, consider using at least part of it to build an emergency fund or pay down debt. Remember, the COLA is meant to help you maintain your purchasing power, not necessarily improve your standard of living. I want to address a concern I hear from many of you: what about the future of Social Security? Yes, there are challenges facing the program, and yes, changes will likely be necessary to ensure its long-term sustainability. But here's what you need to know: the COLA mechanism is one of the program's most important features, and it's likely to continue protecting beneficiaries from inflation, even if other aspects of the program change. Let's talk about some practical steps you can take right now to prepare for the COLA announcement and Medicare enrollment season. First, gather your current benefit statements, Medicare plan documents, and a list of your prescription medications. This information will help you evaluate how the COLA will affect you and whether your current Medicare coverage is still your best option. Consider creating a budget that accounts for the likely COLA increase. Remember, while we don't know the exact percentage yet, experts are making educated predictions. Planning ahead can help you make the most of any increase in benefits. Think about which expenses have increased the most for you over the past year and how you might need to adjust your spending. Here's another important tip: don't make Medicare decisions in isolation. Your health insurance choices should be part of your overall financial planning. Consider factors like your health conditions, prescription medications, preferred healthcare providers, and travel plans. Also, think about whether you might qualify for programs that help with Medicare costs, like Medicare savings programs or extra help for prescription drugs. For those of you who are caregivers or helping family members manage their benefits, pay special attention to these updates. The COLA announcement and Medicare enrollment period are perfect opportunities to review your loved one's benefits and make sure they're getting the most out of their coverage. Don't forget to check if they qualify for any additional assistance programs. As we wrap up, let me emphasize something important: staying informed about these changes isn't just about knowing the numbers. It's about understanding how these programs work together to provide you with financial security and healthcare coverage in retirement. The more you know, the better equipped you'll be to make decisions that support your financial well-being. Don't forget to like this video if you found it helpful, and share it with anyone who might benefit from this information. Hit subscribe if you haven't already, and leave a comment below with your thoughts on the upcoming COLA announcement. What percentage increase are you expecting? How are you planning to use any increase in benefits? Let's start a conversation and help each other navigate these important changes.